Advocating for her health, actress Olivia Munn is opening up about breast cancer. You may have seen her on national news this morning. After undergoing several surgeries, she recently posted pictures of her journey to empower others not to feel insecure.
Now, Sydney spent the day with a plastic surgeon at Mercy Hospital. And Sydney, there are actually some options that people have when it comes to fighting breast cancer.
Yeah, a lot of options, and that's part of his job, is letting people know what their options are. Now, there are different types of treatment, from lumpectomies to mastectomies, removing either part of or the whole breast. Dr. Michael Curtis is seeing a concerning trend, though, in his practice: women being diagnosed with breast cancer at earlier ages and with their cancers at more severe stages. Now, he says decades ago, most of his patients were 50 to 60 years old. Now, he's operating on more women in their 30s and 40s. Now, right now, the standard mammogram age is still 40, but younger women are not getting scanned. They're finding lumps in their breasts after the cancer has progressed. And it's not just a problem found in women. The Susan G. Komen Foundation does report that men are often diagnosed at a later stage of breast cancer than women. Now, one reason could be that men are less likely than women to report signs and symptoms, and that could lead to later detection. That affects their reconstruction surgery as well.
Some of those men present with tumors that are much larger than with women who receive regular mammograms and surveillance. So sometimes the reconstruction with those men is to provide wound closure or to provide a normal contour to the chest, and not necessarily to create a breast.
Now, Dr. Curtis says that most men receive tissue-based reconstruction surgery rather than getting a silicone or a saline implant, guys.
It's so important, though, because one of my dad's really good friends had chest cancer, and he was so ashamed, which is ridiculous, right? But he was so ashamed. He really did take all that in by himself, and he needed support, you know?
Right.
It's real important. We talk about it in our men's health segment for men to open up and let other men know so that everybody could be aware. One of the things that the doctor talked about was breast reconstruction surgery. Just how often is that taking place after a woman has her breast removed?
He says more and more, and you know, more women are even opting for the mastectomy, but they're coming to him afterward to explore their options. He says about 80% of his patients go forward with the reconstruction surgery after having a mastectomy. And he did want people to know that the implants, the silicone implants, have come a long way since the 80s and the 90s, look a lot more natural and are less likely to rupture as well.
All right, thank you so much.